My name is Andy Williams. I'm a fellow here at Steadman Hawkins Clinic of the Carolinas, part of Prisma Health. I grew up in North Georgia before I went to get my undergrad in Atlanta at Georgia Tech. I went down to Augusta and went to medical school at the Medical College of Georgia before going to residency at Orlando Health down in Florida. Then now I'm back up here in South Carolina in Greenville for my fellowship. Coming here to Steadman Hawkins, I love shoulder as much as everybody, but I also wanted to be able to do hip, knee, and trauma and everything in between. And so I knew that being here would give me the opportunity to be ready and anything my practice needs. I think that a true physician can see into a patient what they need and then help be the person to provide that in their moment of brokenness. For me, growing up in a rural area, it helped me really get to know the working class people of this region, North Georgia, South Carolina, but these people are everywhere from all parts of the country. And they're good people who need care, and they work hard and they take care of their families and they like to have fun and they wear their bodies down doing good hard work. And so I love meeting those people just as much as I love meeting a high-level athlete with a hurt elbow. I love meeting a guy who has to hammer in fence poles and his shoulder hurts, or someone whose hip hurts and they really need to be able to go walk and deliver the mail. Those people are the ones who really need to get back out there and doing what they either need to do or just love to do. Well, what do I like to do in my free time? I have a wife and two little kids, almost 3-year-old and a little over a 1-year-old, so I stay really busy going around to the parks in Greenville. I've gotten to know them very quickly. I also love to do some endurance running, and I came from Florida where there are no hills, and then in Greenville, it turns out there are a lot more hills than I anticipated. So my lung capacity is currently increasing drastically. I had a pretty rural upbringing with hunting and fishing, and the medical community is so pristine and proper most of the time, but many of our patients come in and they like to hunt and fish and they like to be active. So I love when I can just sit down and talk to somebody about what they're getting into out in the woods and really connect with them on that level. And these patients who live around here are just like that. And so we can just have a normal conversation and understanding where their life is and what they need to get back to doing what they love.